As part of his training as a clinical scientist in the National Health Service, Didi Akin-Lee has been working with patients with walking difficulties. Most people take the ability to walk for granted, but for some, as a result of illness or accident, this ability is severely impaired. Doctors can sometimes improve the quality of life for patients with mechanical devices or surgery. However, they first need an accurate assessment of the patient's problems, which is where mathematics and engineering comes in.
We see a lot of children with cerebral palsy. Children with cerebral palsy have a problem with movement and the control of movement, and as part of that problem develop deformities in muscles and joints of their lower limbs. To treat them, to help them to walk better or to help them to keep walking, we need to understand how they move and try to understand what's causing the abnormalities in their walking. To do that, it means we need to find a way to assess complex movements of all limb segments and joints in 3 dimensions, and we need to get that information in a way that we can understand it and that we can rely on it. So to do that, we work quite closely with physicists and engineers.
When we analyse how somebody walks, we tend to break down the stages of walking into different individual phases. So take, for example, one walking cycle. The first event is the left heel contact here, and then the next gait event is the right foot off here. And this right foot swings through, we have our right heel contact, then we have our left toe off, left heel contact, and then we've completed one full cycle. We get a number of different measurements out of the subjects. One is called kinematics, and that's the position of each of their joints and the angles between their body segments as they're walking. The second of those is kinetics, which is to do with the forces that are involved with walking and the accelerations of the different body segments as they go. And the third of those is electrophysiology, listening for the neurological control of each of our muscles, so we can see when our brain is trying to activate the muscles. And from those 3 sets of data, we can get a lot of different information about how somebody is walking.
In this first example, Didi is going to look at the kinematics of walking, specifically the angle of rotation at the knee.
So here we have a very simple 2D example. It's a side view of the leg, and the leg has come into the stance phase. That's just after the heel contact as the weight of the body is rocking over our toe. And so in a situation like this, we may have some kinematic data. We know where our hip H is, we know where our knee is, and we know where our ankle is because of the markers that we've placed. But what we're really interested in gait analysis is the angle between body segments. Because people of various shapes and sizes, it makes more sense to look at the angles to try and diagnose any particular problems rather than looking at things like where is their knee in space, because that could vary.
Using some typical measurements in meters, Didi writes down position vectors for the hip H, the knee K, and the ankle A. The thigh is then described by the vector HK, which is simply the vector subtraction K minus H. Similarly, the shank is the vector KA. The thigh length is the magnitude of the vector HK, which using the example figures works out to be the square root of 0.26. Likewise, the shank length is the magnitude of KA, equal to the square root of 0.2. Finally, Didi uses the equation for the dot product of the vectors HK and KA to compute the required angle theta between the thigh and the shank.
Just to rewrite that, and the result we get is about 37.9 degrees. And so we've worked out this angle at one particular time point. But in practice, this process is actually a little bit more complicated because we're dealing with markers in 3D, and we have to define the center of each of our joints before we can even get to this stage. So what we end up with is 3 angles. We have the angle that's projected in this plane, like the one we calculated, but there's also this angle here, and there's a twist angle as well. And you don't see much of those other two at the knee, but in other joints around the body you do.